And here's a story you will only see here on BT. Nearly 4 in 5 hospital workers are not confident in the Ontario government's plan for healthcare. 2 in 5 say that they are considering quitting altogether. Those are just some of the alarming results of a new Nanos poll of hospital workers here in the province. Sharon Richer from CUPE is joining us live now to provide BT an exclusive sneak peek at those numbers. Sharon, thank you so much for joining us. We appreciate it.
Thank you very much for having me today.
First off, if you can go through some of the numbers, one that stood out, one of the headlines was 41% of hospital workers right now, according to this poll that was done on behalf of CUPE, say that they dread going to work every day.
Absolutely. These numbers are hot off the press.
Yeah.
And I have them here today just because it is a sneak peek with BT television. But 44% of our hospital workers are having trouble sleeping. They're experiencing depression. 26% of them told us that they are experiencing depression. They dread going to work every single day, 41% of them. These are hospital workers such as registered practical nurses, PSWs, the clerical worker, support staff, maintenance workers, and many more of our members that we represent.
Right, and a lot of these hospital workers, they say what's leading them to some of the mental health tolls that we're seeing and that you mentioned, you know, suffering with depression, lack of sleep, and so on, has to do with the working conditions and the lack of staff, something that has been a concern for the last few years here in the province.
It has been a concern for quite a few years, but we're really at a tipping point right now since COVID. COVID has changed the look of hospitals as well as other respiratory viruses, and people's workloads are crushing them. Staffing is a grave issue that we're actually seeing every single day. People are leaving the hospital. Currently, right now, we have about 19,000 vacancies in hospitals across Ontario. We estimate that in the next 4 years, we'll need about 60,000 healthcare workers to work in hospitals. And with the workloads that they're having, people are just feeling overwhelmed, and you know, the stats are showing that they're just considering leaving. 2 out of 5 healthcare workers are either considering or thinking about leaving over the next year.
Now, the lack of staff, of course, impacts the quality of care that patients do see when they're in hospitals. The province has said, though, that they have hired a record number of nurses over the last year, and they have made those investments in programs to recruit more nurses. But are you seeing that reflected in hospitals?
We're seeing there is a recruitment and a retention problem where they're recruiting people, but people are not staying when they're seeing these workloads. And currently right now, OCHU is in bargaining with the Ontario Hospital Association, and we're trying to address some of these workload issues by actually talking to them about patient-staff ratios, so looking after less patients, which would help with the continuity of care and, of course, with patient outcomes beneficial to the patients, as well as morale would increase if their workloads weren't crushing them. We are also talking to them about currently right now, OCHU, 50% of people only have full-time jobs. The other 50% are working part-time. So we're looking for more full-time jobs to increase up to 70% over the next 5 years.
All right. And OCHU, of course, is the Ontario Council for Hospital Unions here in the province. When you are going to be making this full announcement and giving us more detail as well at Queen's Park at 10 o'clock this morning, have you been in discussion with the province about what exactly you want? Because there are some key things that you think can be changed in order to make this problem go away, or at least reduce the staffing crisis that we're seeing now.
There is absolutely things that you know, we think can fix. Certainly the staffing ratios that we've been talking with the Ontario Health Association. We are also looking at obviously full-time jobs, But we're also looking at increasing the beds. So we need about 8,000 more beds in the healthcare sector. We also are looking for more funding. So $1.25 billion over the next 4 years on top of inflation would definitely help out by hiring more staff, bringing down workloads, making the morale better. These are some of the key issues that we're going to be talking about, certainly at Queen's Park and as weeks go forward with the government.
All right, and that news conference this morning at 10 o'clock at Queen's Park. You can follow along on citynews.ca as well throughout the day. Sharon, thank you so much for joining us. We
Thank you
appreciate
very much
it.
for having me.
All
Thank
right,
you.
it is 7:39 here on Breakfast Television. Time now for a look at the forecast, and we say good morning to Frank once again.